Hello, my name is Leung Lei Ka. I received the question is question 2. So for the first question, we need to know further information to ask the subject. So now we have the onset history, aggressing factor, surface of VS pain, and spread of the refer pain, and the previous treatment we have. So we need to ask more the further question is outcome expectation, what is the expect result for him, and the easing factor, what makes him feel better, such as eyes, hot pad or massage, any other, and the past medical history, such as the any furthermore body part for the injury history or health problem. And the drug history other than the painkiller or inflammation medicine, so such as the asthma for the lunch problem anymore. And the social history, we need to know how long for his working hours is affect his injury or anymore, and ask him any habit, playing sport game, playing and other exercise, or have smoking, alcohol, other habits. So we need to know this. From the information provided, limit range of motion of doing leg rotation and count during the flexion movement. He feel VS pain of 7/10. This is a highly painful level. Also get the symptoms to shoulder or arm coaching, get rid of pain, sleep pain, also pain in all movement. So although it is an acute pain stage, but it is passed away from the information phase from tissue healing, and he has taken the painkiller. So expect will get better, but finally it is no improvement of his pain level. So his symptom is high irritability. Also, the cervical radiculopathy nerve in the leg is compressed or irritated, so become the radial tense into the shoulder. And also, the subject mentions he has a sharp pain and shoulder pain. So maybe this is the nerve root problem, and the nerve root irritated caused due to the spinal disc problem. And cervical spine, unlike the lumbar spine, where the traveling nerve root is more commonly irritated in the cervical spine, this herniation is more often affect the exiting nerve root. Based on the common symptom of the weakness, neck pain and tenderness, neck stiffness and difficult moving the head, muscle spasm, pain in the shoulder and the arm, we have the two hypotheses match with the subject's symptoms. This past was possible structural damage from the weakness injury. The first of all is the cervical ligament sprain, because the symptom is very similar with the subject information symptom, and he will get the pain, especially in the back of the neck, and the worsen with movement, and muscle spasm and pain in the upper shoulder, and increase the irritability and difficult sleeping, and the numbness in the arm and hand, and leg stiffness or decreased range of motion, and the weakness in the arm. And the second, we think he got the cervical radiculopathy from the hernial disc for C4 to C5 injury. The symptom is because the hernial disc is one of the most common injury in the automobile accident. The impact of the cushion puts excessive stress on the spinal column and cause a disc in the between the vertebrae to move out of its normal position. These injuries are often diagnosed as a slipper or a ruptured disc, and also is occur in the unilateral part, and weakness from the arm, sharp radial pain, and decrease the sensation on the shoulder, occur with the lifting, pulling, bending, or twisting movement. Also, C4 help control the upper shoulder movement. The C4 the metamal cover part of the leg, shoulder, and upper part of arm. The diagram is large supplied by the C4 nerve root, which could affect the respiratory system. And also, the hernial discs are at the C4 to C5, but go affect the C5 nerve and can affect the sensation around the shoulder area. And the bicep reflex is primary C5 and will affect the motor function of the deltoid and in elbow flexion. Also, the C4 and C5 discs can herniate direct into the spinal cord, causing a spinal stenosis condition. Although this process is normal to experience in asymptomatic degree as we get older. When the spinal stenosis is diagnosed, the henoid disc may impact the decal site, but has no noticeable effect on the actual spinal cord, even if it displays its normal position. In other cases, true cord compression may result and may produce a diversity of very terrifying symptoms throughout the body. Firstly, I need to clear the reflux problem. So I need to ask you some questions. So do you have any weight loss, fever, or light pain?
No.
And do you have the urinary urgency?
No.
And do you have the interval drug use?
No.
Okay. And also, do you have some depression on your injury?
No.
Okay, very good. So we go to another stage. Okay, I will do the palpation of the shoulder area and the painful level. So if I will compare the different sides of the pain level of her and feel the temperature in the skin, is it hot or cold or anymore, and how painful of her in the area, and is it very high irritability, and is it have any abnormal sensation, and when I touch her from leg to shoulder and to the arm. Then I will observe the any swelling of her in the leg, both side area, and the posture is it normal or abnormal. This is have kyphosis, nodosis, or scoliosis alignment. And then I will see her walking gait. So can you show me your walking? Okay, so if she have the abnormal walking gait, her foot will have the drop gait, cannot do the dorsiflexion, or the hip cannot close it together. So her walking gait is very normal and good. Then we will go to the active range of motion test. So can you perform the flexion, extension, and lateral flexion and rotation to me? So first of all, I will check the C1, C2. So please perform the flexion, yes, and the extension, yes. And the C3 is the leg lateral flexion, left side first, because we will do the good side for the injury first. And then C4 is the shoulder evaluation, yes, and relax. And the C5 is the shoulder abduction, and do it the left side first. Okay, this is the good one, and the worst one is the right side, yeah. And go to the C6 elbow flexion with wrist extension. Extend and then wrist extend, yes. And the other one, elbow flexion, extend, yeah. And go to the C7 elbow extension and the wrist flexion and other side. Okay, and go to the C8 front flexion, left hand and the right hand, and the T1 finger abduction, left hand and the right hand. Then I will do some strength test, and I will give you some resistance in the movement. So the C1, C2 first, the leg flexion, and then extension, and lateral flexion for C3, and the C4 is the shoulder evaluation, and C5 is shoulder abduction. Okay, I will give you some resistance, and the other side. Okay, and C6 is the elbow flexion with extension. Yes, extend. Okay, other side. Okay, and the elbow extend with wrist flexion, extend and flexion. Okay, other side. Extend and flexion. Yes, and the C8 is the front flexion. And the T1 is the finger abduction, just abduction. Okay, let's go to the special test. I will test the spurring test. This test is performed to assess the cervical nerve root pain and the impingement. So I will do some lateral flexion, some rotate and extend, and I will give you some pressure. So test any pain of the left root. Now I will test the sensation of her. So I will check the C4 delta, any sensation of her. Okay, no. And go to the C5, we'll check the bicep. And check the C6 of the wrist, extend. Okay, and no. I think she got the hinge disc problem in the C4 to C5. And so I will give some treatment and exercise to her. So she got the disc damage problem. I will perform the unilateral PA mobilization grade 1 to her. Grade 1 is a small amplitude movement at the beginning of the available range of movement. This is the lower grade I use to reduce pain and irritability. And reduce pain and stiffness are the major goal in this treatment. 20 times each segment. Aim for 2 to 3 oscillation per second by mainland mobilization theory. Now I will show you the unilateral PA mobilization grade 1 to her on left side, because I need to avoid the danger place in the right side, because she may got hinge disc and on the C4 to C5. If using the central PA or right side unilateral PA is very dangerous, and also she is very high irritability. So I will use the use the left side, and this is the non-painful place, is more safety. And first of all, I need to find her spinal process and go to the transfer process, and then the front maybe side on the transfer process, and going to the unilateral PA and put some pressure on this one, and 20 times of each segment, and then we'll go down same place. So I will apply the grade 1 level of her, just reduce the pain and some muscle spasm and the stiffness, and going down put some pressure of her. Okay, I will give you one home advice to you. So I will give you the neck extension and support with the tower. And the tower is very important because for her to support the leg movement. So this stretch can release some of the pain symptom and push this material back into the place. And so you can do it in the pain-free range. And the passive performed stretching exercise are used to increase the flexibility and preserve the movement, preserve the motion. So a little discomfort is to be expected. So for this exercise, you need to sit good posture, and then holding the towel wrap around your leg. So then now stretch your spine up and over the back of your chair, and keep the tension in the towel to support your leg. Do 5 to 10 times 3 sets. Yes, and do it again. Yes. Now I will give you 2 exercises that can improve her posture. And so first of all is the chin tuck. This please do it in the pain-free range, and this exercise will help to improve the strength and of the deep neck vessel and front of the leg muscle, helping to reduce forward head and round shoulder posture. So first of all, please sit the correct posture. Yes, and restrict the leg back and restrict the chin at the same time. Then hold the chin tuck for 2 to 3 seconds. So and then relax and do it again. And please repeat 10 times and do it 3 sets. And the second exercise is one arm pectoral stretch. And this is stretch out of the chest area. Muscle spasm make your muscle to more tightly and pull the leg into a back posture. Release the pectoralis will allow you to be in a better posture and can elevate some of the pain. So first of all, you will need to closest to the wall, and one arm this way, and then keep forward to your leg, yes, and put some pressure forward, and stretch your chest area. Feel the stretch in the chest area. Avoid to just stretch your shoulder. So you need to adjust some angle and make sure you are stretching on your chest. and hold 30 seconds and repeat the other side. This finish. For the precaution, please do not deviate from the instruction given and do it safely. The exercise when done correct is very safe and effective. If at any time during the exercise you experience sharp pain, discomfortable, dizziness or numbness and tightening, stop doing the exercise and consult your chiropractor. And the low-grade muscle soreness may be expected as you are using muscle and that may have been inactive for some time. So thank you.